And recording is starting. Should I say got it?
Yep.
All right. Hey, everyone out there in Zoom land. How are you? Today we're this is going to kind of tag off of what Dr. Buka Putnam talked about as far as the mind and the body and the connection there, which there is a connection there, whether it be an electrical connection or a chemical connection, or both. There's a connection. And believe it or not, the rest of the body will send signals back to the brain, just as the brain sends signals back to various parts of the body. But today we're going to look a little bit at, maybe what the nurse knows and maybe what the patient knows or doesn't know about that connection. Because in my experience, patients are very stressed out. And maybe they do, maybe they don't realize that the stress and agitation makes everything worse. Everything from blood pressure to pain level to even how your immune system responds. So let's go forward. Here's some interesting facts regarding the mind-body connection. Some of them you've probably heard of. We all have a mind-body connection. An example of that might be if you're nervous, you get this sensation of butterflies in your stomach, or you might become sweaty, or you may actually sense that your blood pressure and or heart rate are going up. So that's one. There's another one here. Our bodies do react to how we think. If we're thinking positive thoughts, if we're thinking reinforcing type thoughts, that has an impact on our emotional state. On the other hand, or on the other side of that coin, on the flip side, if you have a negative types of thought patterns, maybe negative types of self-talk, which means maybe you're being very hard on yourself about something, that also affects your emotional state. And our emotions will show positive, negative, or somewhere in between. It shows up in our emotional states. So we can make ourselves sick and we can make ourselves better or well. An example about that is stress. It's good to have a little short-term stress because we need that sympathetic response in order to respond to a situation clearly and focused. However, if one is chronically stressed out, that is a negative impact. And in the day and age we live in today, many of us develop chronic stress patterns or stress responses that do have eventually a negative impact on our organ systems, the heart, even how we digest, negative impacts. On the other hand, we can enhance that move toward wellness or recovery by adding positivity to this, seeing it from a different side rather than focusing on perhaps the negativity of a certain position, like being sick in the hospital. So there is some control there. There is some control. Because if you're thinking positive about something that otherwise even if it's a good thing or maybe a slightly negative thing to a real negative thing, if you're thinking positive about it, there are chemicals in the body that get released that actually help enhance the immune system, as well as enhance your state of being, your state of well-being. We also have a body-mind connection when it comes to, I want to say the body sometimes is where that connection starts rather than the mind. We talk about mind-body, well, in some cases it's body-mind. And that can be through illness versus something else like exercise or some other activity that might bring you joy. And the body responds to it, and it changes what's going on in the mind, not just your thoughts, but thoughts have a big impact. Okay, food affects both our bodies and our minds. That would be everything from a nutritional intake of, your diet to, well, of course, what composes the diet? Some foods, of course, are healthier than others. Some affect the brain different than others. For instance, caffeine, of course, you'd probably hear that brought up on so many occasions. In the short term, it has a decent impact, a positive impact without much harm, but regularly, it has both a body and a mind impact. All the negative aspects of caffeine, if put in a situation where it's consumed every day. An example of that is my oldest brother. He smoked. He would drink about 2 pots of coffee a day, but that was his pattern. He was negative quite a bit. Don't know if it was the caffeine, but I could tell there were some other things about caffeine, and then the stimulant in cigarettes, nicotine. Both are stimulants. I could see some of the adverse effects. Regular sleep is a must. The brain stores memory, neural pathways are reinforced, pathways not used begin to get pruned. All of that happens when you actually sleep, provided you are getting enough sleep. Meditation has been shown to help your heart by lowering things like blood pressure, lowering heart rate, helping in that preventative process of avoiding heart attacks to preventing other heart attacks. But it's the relaxation part, the calming effects, that help restore those vital signs to normal numbers. And they help to moderate anxiety and depression, which both of those have an impact on your cardiovascular system in negative ways. So those are just some facts, straight up. So what is this connection? Why is it important to healthcare, to healthcare in general and to the patient? Well, it's a framework of both a psycho, brain, and physiological body explanation of, these therapeutic properties. Some of the traditional interventions as nurses, well, a traditional intervention doesn't do a lot. If you go in and start an IV or put a catheter in or dispense meds, those are the technical traditional role, parts and pieces of being a nurse. However, having a new model that incorporates the brain, the mind, and that connection to the physiological, this model allows us as nurses to move from that traditional base, which isn't bad. It just doesn't include more of a knowledge base, a holistic approach to the person who's sick, ill in the hospital. In other words, you're not just an EKG, you're a human, you're an individual, etc. You also react to illness in different ways. Everybody reacts different when it comes to illness or severity of illness. And in many cases, it's usually a not so healthy response. In others, because I can tell you from experience, I've seen anxiety, I've seen depression, I've seen hostility, or some variation on the three. And of course, those have negative impacts on the person, the patient. And sometimes it's difficult as a nurse to try to talk in a therapeutic way. We learn therapeutic communication because now it's a part of our care. Years and years and years ago, it wasn't emphasized. Now it is. So that how we communicate with patients makes a big difference. And I would say too, it depends on the individual. Some patients, clients are not willing to listen, but you can fulfill some way about going about it by simple things like sitting and allowing the patient to talk to you for a few minutes rather than going, hanging an IV piggyback of drugs and leaving. Or expanding on something you might have said to the patient as a nurse, sitting down and talking to them about it at an eye level. So sitting in a chair at eye to eye with a patient who's in a bed. Or other basic things. Is the temperature in the room comfortable for you? Lighting? Do you want the door closed? Do you want the screen closed? Yeah, is the TV working? Et cetera, et cetera. And sometimes if you leave that individual, once you leave the room, you leave them in a satisfied position, that tends to change their mindset as well. Changes yours as well, because you know, number one, they will have fewer reason to call out to the nurse's station if you fix them up before a problem happens. And boy, I could expand on this all day long, but there's no time to do that. That's just an example. Yeah.
Possible in today's world for a nurse to sit down.
Okay, the question is asked, in modern healthcare, is it possible for the nurse who has multiple patients, usually most who are pretty sick, is it possible to sit down and talk to them in the therapeutic way that we're taught to do so? Well, sometimes it's practical, a lot of times it's not. So it has to be exhibited in maybe other ways. You know, should I turn your lights out? Do you want your bed lowered? Is it noisy outside? Do you want your door closed? Are you in any pain right now? Are you feeling anxious? Can I get you something for that? If it's time. Sometimes it's left at that. Sometimes you don't have a whole lot of time to talk. So I would say it's sporadic. It's sporadic. It's not going to be the same across all the patients you're caring for in one day. That's a good question too, because we're taught in school to be this way. However, there's very little time for it. And so it's the ideal. If nurses had the time, they should be engaging in that kind of communication, that person to person, mind to mind communication in a therapeutic way, as to they feel listened to, they've given you their what they like, what they need, etc., then they begin to like ramp down. Blood pressure, heart rate begin to go down. Plus, if you're only there for a moment and don't listen, don't do anything as far as talking, or you say you're going to do something, you don't do it. There's also the trust factor. Does the patient trust you? If the patient trusts you, that tends to have a positive influence on the patient and the patient's outlook, even if they're really sick. However, the practicality of a lot of that, that's a big issue today. That's a huge issue, in fact. So understanding, why is understanding and knowledge of the mind-body connection so important? Well, it's lumped into, it's not really lumped into, at the center of it is holistic care. So we think of the person as not just the illness, cancer, for instance, or heart disease, but we break the person down into spiritual aspects, social, psychological, and physical as well. And I emphasized in light blue here, the gist really is it's a comprehensive approach to people and to illness, because it includes the whole person rather than, hey, I'm taking care of your heart disease today. You are heart disease, you're in room number, 12B, patient in 12B. Yeah, that patient in 12B has a telemetry monitor on. They've got all these other gadgets hooked up to them. Then it becomes, that individual is their illness instead of a person. That is why this is important, and to have knowledge of this. And I add, nurses have multiple demands on the job, and they do. That goes back to what you mentioned. That now include, on top of everything else we do, a mind-body approach to nursing care, to healthcare. And it's not just for mental health RNs. Mental health RNs, yeah, they dispense meds. They're part of group sessions. But they have more of an opportunity maybe to talk one-on-one with a client than we do, where patients are medically ill versus some sort of psychological illness which landed them in a psychiatric hospital. So that's why it's important. This is the direction we're heading. So science, and I put in blue here, some of the research. Now, patients often won't be able to focus on their illness or what they need to do to feel better if they are emotionally distraught. And that is very true. If an individual's in the room and they're upset, they're worried, they're angry, they're whatever you want to call it, depressed, anxious, that is going to have, it'll have a negative impact in the sense that how can you focus on getting better, focus on what you need to do to get better, if you are constantly in a negative emotional state? So again, it can be more than just being depressed or anxious. It can manifest as other things too, like refusing to work with the nurse or the doctor or the therapist. It can manifest in other ways. You won't take your medications. You simply hide under the covers. A lot of patients do that. They don't want to be bothered by you. You're in the room with them and you're trying to get their attention. The covers are pulled tightly over their head. And you begin talking through the covers sometimes. It's true. And sometimes you're successful of getting them out from underneath, that barrier. So, or sometimes you get them, instead of not responding at all, to respond to you through the covers, and you hope in a nice even toned way where they hear what you're saying and you hear what they're saying, truly. Some studies, at least this particular study shows that parts of the brain, the areas that control movement, especially, are plugged into networks involved in our thinking and our planning, which be parts of, I want to say, our frontal lobe, part of the cortex, and then other parts that are in control of involuntary bodily functions, such as the blood pressure. Those would be deeper structures within the brain that you don't think about. So the findings of the same study represent a linkage, a clear linkage between body and mind, and by mind meaning to the very brain structures within the brain neurologically. They've mapped out rather, through functional MRI and PET scan examinations, what's going on in the brain when the person inside the device is given certain tasks, what areas of the brain are being used as they light up. And what happens if someone becomes in an emotional state in there by seeing certain pictures, or I want to say scenes that might turn them emotional up here. They can actually map it and find it through these studies. It's cool. Now, who's affected? Well, really, the nurse has a big part to play in some of this. And again, going back to, how care given today is supposed to be more holistic, supposed to be more patient-centered and unique, in order to focus and emphasize each individual as a separate individual, instead of, all the rooms down the back end of the hallway, or all these patients over here, they've all had colonoscopies. So instead of identifying them that way. So, yes, what it means, at least in part, is that our thoughts, feelings, and beliefs, because that's another thing too, allowing patients to observe their beliefs, and then you observe what they believe, and you mold care around that, which is a big deal. That can influence whether or not your relationship is going to be trusting and good, or whether your relationship is not going to be a very trusting relationship. But this mind-body connection impacts the body and the mind. So here's a biggie: the digestive system. You've probably heard that it's referred to as the second brain. Well, this is because it's rich in nerve endings, for one thing, nerve endings and receptor sites along the entire digestive tract. So these nerves are, of course, involved in digestion of food, fluids, those kinds of things. And the receptors are very similar. And so that's why biologically, medically, it's referred to as a second brain, because it directly communicates to the mind and the brain itself what's going on here. And this is an example of, something starting down in another organ system and communicating back with the brain. Sounds technical too. It is, but it can be boiled down to that for the purposes of, of this presentation. And I want to say, emphasizing the connection here, there are neural pathways. I mentioned earlier, neural pathways. We actually have, neurons reaching down, going down, and then coming back up, communicating back and forth. We have neurotransmitters released by these individual nerve cells to propagate communication one way and then the other. And then hormones get released usually directly into the bloodstream. And those chemicals carry a message to some other part of the body. It's a form of communication. So these pathways do transmit signals and communications between the body and the brain. And I want to say sometimes, a lot of times, it's really not something we think about. It's not something we have voluntary control over in many cases, but they affect everyday functioning. Now, there is a section of the brain, the emotional cortex, and that would be, there's part of it in the frontal lobe. There's part of it, I believe, in the parietal lobe as well. These parts of the brain that deal with emotions. Forgot two very important structures here. The amygdala, which we do call the emotional brain, and then the hippocampus. And that includes also its frontal lobe, what we call the prefrontal cortex. All of those are active in stress response. And so, again, the brain is responding to what is going on in the environment. You'd be surprised how much the environment changes the way you respond to things. If an environment is favorable, your response is going to be favorable. Now, if your environment is not so favorable, it's going to impact stress levels, stress response, in a negative sort of way. So environment is not something I touch on too deeply here. And this is another reason why I talked about those things that nurses try to do to change the environment a little bit. Decrease noise, external input from whatever devices as much as possible. Lighting, temperature within the room, the closeness of items the patient needs to get a hold of and get at. A calm voice, whether entering, interacting, or leaving the room. It, in general, brings about a positive response out of the patient. Now, going back to what you mentioned about time to do all this communication, I'll be quite honest with you. There isn't a whole lot of time for that, and it doesn't get done for the most part. And this is where nurses have to prioritize and treat each patient as unique. This individual doesn't need this kind of, fluffing up, whereas this other individual may need it in order to maintain positivity, in order to keep them from going to the dark side, so to speak. So this is where the nurse has got 4 or 5 things going on when it comes to approaching the individual patient. And it is another layer of care, though. It is another layer of care.
Like pushing the computer around.
Besides pushing computers or pushing the on-off button on a pump.
Yeah, they get really upset if you push down off button on something.
Yeah. The patient will do that when you don't answer the call light. For several minutes, your call light has been on. Well, a patient's going to get quite frustrated with that, as many of you probably already know. If you don't come and do something about it, I will. Can you blame them? No. And this is why, typically what I do is I ask them politely, please don't try to get out of bed without calling for help, either from me or from someone else that can come in there. I said, I don't think it's safe for you to be up without assistance. And if you put the call light on, I will do my best to get into the room as fast as I can, okay? It may not be the moment after you put the call light on, but I will answer that call light and tell you I will be in there in 3 minutes. The thing is, if you make a promise like that, you should adhere to it. And a lot of nurses play loose and fast. Be honest. If the patient knows what you're doing, they're maybe not as likely to get as upset. If you tell them you're going to be there in 5 minutes and you end up being late 15 minutes, then perhaps stop by the room with whatever it is you have in your hands and say, I'll be back in 10 minutes. I've got to do this really quick. So you'd be surprised how much nurses have to prioritize, and they have to think on their feet constantly. So if our bodies feel under attack, not just by disease, but even if it's not maybe immediate danger, we turn on that fight or flight response, and the sympathetic nervous system goes into play. And different stress hormones, one of them being adrenaline is one of those hormones. Cortisol is another hormone. They're meant to be short term. They're not meant to be activated continuously. So they send a signal to other organ systems to either breathe faster or really more shallow, heartbeat faster, skin to sweat, muscles to tighten somewhat, blood to shift or shunt to the areas that now under this threat, you need the blood will need to get moved to. In other words, digestion is not the priority. However, maybe in other areas of the body, more blood is needed to counter this. So, and that will also take place neurologically as well, signals. Blood sugar will take a spike because, believe it or not, your mind and your response to stress is going to raise your blood sugar, whether you're diabetic or not. It's going to do it. That's why some patients say, why in the world is my blood sugar so high? I'm not diabetic, or my blood sugars usually are down here. Why is it so high? And I try to explain in some cases that, well, you just got out of surgery. Your body is in hyperdrive to, deal with this as far as the healing process goes and the stress to meet these demands. I said, it won't last forever. I said, as you get better and your stress levels go down, your sugars will automatically move in that direction because your body won't have as much need for that. Sometimes the patient is like, huh? So I try to put things in as much in layman's language as I can. And then this is another reason why patients, when they go to see the doc and they get a blood pressure taken, they're sky high because they have this anticipation, this white coat syndrome. When they leave, their blood pressure is normal. So the symptoms you would, when you think about it, stress, fight or flight, or freeze response, you'll likely see some symptoms in the form of nausea, muscle tension, tightness in the chest that might resemble angina, but it isn't.
It's like breathing shallow.
Yes, absolutely. And these are just to name a few. There are many different manifestations, examples of what happens if the fight or flight response doesn't resolve itself and you go back to the status quo. Now, physical symptoms from emotions. All of your physical symptoms in some way have a small emotional element. So when we're injured, we feel the pain physically, psychologically, emotionally. We may start focusing on the pain and feel very anxious, angry maybe because we're not getting listened to or responded to quick enough, sad, distressed, cry, all of that. Again, this is some reiteration. Stress hormones like cortisol takes a toll on the body over time. And it hits the immune system pretty hard too. Your ability to heal, your ability to pull out of, I want to say, viral illnesses, flu, colds, COVID, whatever. There's the negative impacts on the heart and the cardiovascular system, because when you're stressed, those blood vessels tend to shrink. What I mean shrink up is that they tend to narrow as a response rather than stay open. And so that's going to increase blood pressure. I guess once we're aware of that connection and the negative or the positive impacts, we realize the good or the damage that can be done by our thoughts and emotions. So keeping that in mind, it's hard to tell a patient that, so I keep things very simple. The good things, positive things, endorphins are released. You have serotonins and dopamines. Some of these substances make you feel good or diminish pain. But in other factors, like you have stress hormones being released, it's going to affect other immune factors in the organs that produce, immune globulins, the different components of how our body fights illness and disease, they get diminished some, not as effective. So this is where things like either hope or lack of hope come into play. Lack of hope has an impact on the body. Hope and a positive feeling and thought has a positive impact on the body. So, good golly. This is more, I'm kind of reiterating here the kind of the mix of different hormones that are only supposed to be short-term, and their impacts on the body. If this is happening every day, these are things you're going to exhibit every day. One can have a heart attack. One can be hastened toward a heart attack due to stress. You've probably heard that already. The risk goes up. At least one study has shown that people with panic disorder, which is kind of chronic, face a 40% increase in heart disease. So to counter these kind of things, you have to stress, the emphasis on stress management techniques, things like yoga or qigong, mindfulness, mindfulness meditation, those kinds of things to counter these other negative responses that you have in your body. Yeah, this is where, you make the environment quieter. You dim the lights, fewer interruptions. I remember there were doctors who would specifically write in their orders, do not disturb my patient between the hours of this and this, so that they might sleep through the night. In other words, don't come in the middle of the night and draw blood. Don't come in the middle of the night and get extra sets of vital signs unless it's absolutely necessary. If the patient has pain, make sure you address that before they go to bed. If they have a lot of trouble sleeping, make sure you address that before they go to bed so that they can sleep. Big deal. Big deal. That's a part of the holistic approach. So, all right, here's some strategies for you as the nurse as well as the patient. Pay attention to your thoughts, because I'll tell you, these kinds of negative impacts affect nurses as well. And if the nurse has in a negative state of mind to begin with, it'll affect the way he or she approaches the patient. And that is the honest to God truth. So pay attention to your thoughts. Change the way you engage in self-talk. Whether it's encouraging yourself, try to stay away from negative self-talk or diminishing self-talk. The way you talk to yourself, encourage yourself, bring about the proper mindset is all important. This will eventually help modify your emotional state. Everybody goes through emotional states throughout the day, either positive emotional states or negative, but this is something too we don't think a whole lot about. But we try to emphasize to try to keep your emotional state in a certain place so that desired outcomes will follow. Hard to tell a patient to do this. It's kind of like they're in pain, discomfort. This is going wrong. This is going wrong. I've got drama outside of the hospital forcing things on me. Hard to tell a patient to keep a positive mind. And this is why it's very important for the nurse to treat the patient as an individual and do what they can to diminish what stress the patient has. So here is where you might ask yourself, as a patient or a nurse, what are some of the mind-body strategies that you put into place? What are they? Do you have any? If you don't, then you need to get some. If the patient doesn't, then I would say spend a few minutes listening. That is part of a strategy into a positive emotional state. You listen to them, they trust you, and they feel better. Trust me, it works, it works, it works. Okay, do you need therapists, psychologists? That cognitive behavioral, what do they call that? Therapy, thank you very much. CBT, cognitive behavioral therapy. It's a big deal. It changes your state of mind. Yoga, you get into a certain state of mind and focus, and out of whatever it was you were, whatever drama or whatever chaos you were in, to pick up something like this is a good idea. Same with Qigong, same idea. Guided imagery, focusing on images, focusing on some words maybe that you pulled from somewhere. Guided imagery. I've got several guided imagery CDs at home. Most.
If you're training, you stumble into Larson's meditation practice.
Take some of that home with you.
With us to the hospital.
Yeah, if you wind up in the hospital and, God forbid you should, but if you do,
Well, just laying there in bed, you could do the breathing. You
Absolutely.
don't need anything else.
If, you know, what I try to do as a patient, and I've had to do it many times, I'm by myself in the room, waiting for a procedure. You know, maybe there's a skylight leading to, you know, whatever outside, or there's a picture. I'll look at that picture. If there's a picture in that room, and I look at it and I try to draw something from it or put myself in it. I know that sounds very weird. Like, what kind of trip are you on?
Kind of cool.
It is. Music changes one's mood. It changes the environment you're in too. Trust me, it does. And this is why I support individuals who bring music with them into the hospital. Listen to certain music during the day, others at night. It'll put you in a psychological, emotional state. Sometimes it decreases arousal and you're ready to go to bed because you need the rest, that kind of thing. And exercise, you cannot exclude exercise. Again, it's those endorphins, it's the dopamine, serotonins. Exercise has all kinds of benefits to the body, but it has multiple benefits to the mind, to the brain. And as patients, it's kind of like, well, I went 100 steps today. I went 200 today. And I said, awesome. That's double what you did yesterday. Or I did 4 laps just in the last few minutes. And I was only able to do 1 or 2 yesterday. And I said, great, keep it up. So responding to somebody else telling you something, this is a goal I just launched. I just inched or put the goal up to another level, and they tell you about it. This is why in the hospital, I get very encouraging of patients when they're doing something. They got out of their room for the first time. They got into a chair for the first time. Even praising them. I had a bowel movement. This was day 4. I said, wonderful. Guess what? I don't have to give you bowel care up your exhaust pipe. And they said, yeah, I'm happy about that. I'm relieved. And I said, so am I. I said, I don't want to cause you any distress, and you don't want any distress either. I said, great, that's wonderful. Keep doing what you're doing. And, so you don't have to think about that. But again, this is where nurses come into play. You want to establish as much of a positive environment and relationship as possible. And I learned a lot about this. I went to several seminars about mindfulness in nursing, mindfulness in healthcare. And I think all nursing students ought to take a class in mindfulness in the healthcare setting, but no such course exists. Doesn't exist. It should. It should. It doesn't matter whether you're a therapist, physical therapy, occupational therapy, respiratory therapy, or a doctor. The doctor. Because you need to be aware of these things. Okay. Anybody out there? Questions, thoughts, stories? Anything you want to share? Examples? Ideas? Contributions?
Perhaps doctors should have when people are coming in, they're going to do a hospital stay, they're going to stay a couple of days. Things to prepare yourself to bring with you that will make you feel comfortable, that will make you, like bring headphones and music and bring your charger, just a checklist of things that will just make it much more comfortable for the person to. Absolutely. So Kevin is mentioning that having a list of things, encouraging maybe that, look, bring this with you, if you have them, or some alternative to that with you into the hospital, because it's certainly welcome and it'll help your stay. It'll help lessen the impact of your stay in a strange place under, not the best conditions maybe at times, and to also affect your outlook. And so I think that's very important. Healthcare is getting better at doing that. Healthcare, there's always a gap about what they can inform the patient of ahead of time, so that when they come in, there are very few, if any, surprises. In other words, guess what? That knowledge will also put a little bit of confidence in the patient and a little faith that, oh, okay, thank you for telling me this is going to happen ahead of time, or that I need to have this with me maybe, or it would be good if you had this, to bring with you, or at least to prep with you. Like Kevin mentioned, a checklist. They're getting better at doing that, Kevin. But that's area where there's always room for improvement. Always room for improvement. Whoops, sorry. Oh, God. All right. So
Rob,
questions, concerns, issues, worries, troubles?
Kara's trying to say something.
Oh, Kara, what's up?
I just, a couple of thoughts, and you may have mentioned this already, but I found it helpful because I've only been in the hospital twice for but they were huge surgeries each time. And I went the day before or a couple of days before and walked where my room would be, the approximate location of where I would be staying, the ward, and to the operating room, and obviously not inside, but I became familiar with the hospital. So there was nothing that I was seeing for the first time at 5:30 in the morning before the surgery. I think some hospitals are doing that now, taking you on a tour. And the other thing that has been really, really helpful, there's a website, and I think it's called healthjourneys.com. And this is a licensed clinical social worker that started this company. Her name is Napperstack, Bella Ruth Napperstack, for a name that you'll never remember. But
I'll never remember that. That's a long word. Or
I
set of words.
first saw that when my very first surgery back in 2004. They gave me this, I think it was a cassette at that point, with a meditation for pre-surgery. She has probably 100 different ones when you're doing chemotherapy, for sleep, for heart, but they're generally the same. And it's not this, what I call the extreme ooh-wah-wah meditation that is not, some people don't find that helpful or they resist it or whatever, but she's just got a very relaxing voice, very down to earth. And in particular, she talked on the pre-surgery one about your band of angels that's in the room during the surgery, watching everything for you. And not in a religious sense, but that means your friends, your support system. It could be people that have your parents, if they've gone on or whatever, but it makes you feel like, I think part of the fear is that you're not in control during that time.
Exactly.
If something bad happens, it's not that you don't trust the medical personnel, but you're used to controlling things for the most part. And the fact that they're hearing the doctors say how well everything is going and so forth. It's just a really, 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 and Kaiser and different places do still provide that CD, but you can order them, their MP3 formats and so forth. And it's incredible. Yeah.
That's a good point. Oh, Kevin, you had a response?
It's a good resource.
Yeah.
Most of the time when you're traveling in the hospital, looking at the standings, you get one.
Well, to respond to, the pre-surgery orientation, in some cases, we used to actually pull out the television and, we would, as a pre-surgical prep, have the patient watch a doctor, healthcare worker go through and explain what's going to happen in order. But they'd have to be there in front of a television. It wasn't a live person. And it was kind of a generic kind of approach they used to use. I think it's a good thing if they have the staff, definitely, to give an orientation to where you're going to go, where you're going to arrive early in the morning to prep for surgery, and then the order of where you're, from here, you're going to go here to surgical suite. From there, you're going to go to recovery room. And from the recovery room, you're going to go to the unit, whichever designated unit. So I think that's a very good point. We're if we're open to it, we can improve all the time, and we need to improve. We need to find better ways of helping individuals, both healthcare workers and patients, improve their mindset, improve their outlook, help them modify some of those vital signs and other parameters that are so important to staying healthy, and maybe leave them with some strategies to take with them. So yeah, very good input. Thank you.
Rob, I have a question. I have a
Go for it,
question.
Patricia.
Yeah.
I had a surgery, it required the whole routine, and it was kind of a magical mystery tour. When I was in the pre-surgery room, before the doc came in, and there were about 3 nurses around and the anesthesiologist, somebody came in asking me to enroll in a research project. And I signed, but I had already had probably some calming drugs, right? They had started working me, right? Or unwinding me. And so it sounded reasonable to me. My friend Jim was there. So fast forward, when I mentioned that to my doc, he has no idea what I'm talking about. So it's like I'm being gaslighted or something. And, University of California, Davis Health System, they've got, I gave them a very full vial of my spit. And, they were impressed. I was very cooperative. I signed forms. But do you think I can find out anything? It's like my doc says, I don't know what you're talking about. Sure, we'd like to do research, but, blah, 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 blah. I'm not asking you to solve my confusion or the mystery of it.
I'm
But
gonna say that's on the doctor. Yeah, your stuff is in your chart somewhere. So you need to ask somebody else. Just because your doctor doesn't know about it doesn't mean that it's not a known entity. Somebody in that system knows about you. The stuff you signed is in your medical record. It's in your chart. Somebody can find it if they.
I didn't buy a used car from those people. They were really good.
Yeah.
They were really good. I'm not, they intended to get me into this research project.
They probably
Well,
should have, Patricia, they probably should have done this at a different time.
No kidding.
That was the wrong time to
I
ask a
haven't
question
eaten.
like that.
That's what I feel set up now. But, this was a frightening experience like it is for everybody. I had been in the building for hours. My
Right.
time comes up. And all of a sudden I'm beset with this horde of people, docs, nurses, researchers, whomever. I'm trying to figure out how to ask the question.
Yeah.
Or where and even in this discussion, the salesperson, I tell you, she was good. she said, why don't you stop by sometime and we'll talk to you about the research.
Well,
I have no idea where to
I'm not
stop
going to
by.
remember this conversation, maybe. If they'd already given you drugs, it's inappropriate to have you sign anything.
Okay.
Very, very inappropriate.
Okay. Well, I may not be the most reliable party to testify what they had given me on what timeline, but I knew I was anxious. So even if I didn't have any drugs in me, they had my clothes.
Right.
I was their object. I hadn't eaten for hours. So, I was in a state of surrender.
Yeah. That just seems strange.
Well, I
Yeah.
don't think I dreamt it.
No,
Jim was with me and damn it, okay. You wanted examples of experiences in these, infrequent, complicated situations that, listening to Karen, I wish I had seen the place. I wish I had had some, my goodness, you go into an operating room and, it's like Kliege lights, you are on the spot, every ounce of you. And, they bring you the warm blankets and, then all of a sudden, then it all goes black, right?
right. Then the amnesia sets in, or you wake up and you're wondering where in the world you are.
It was a Friday afternoon before Christmas.
Ah,
You do not want to ever do a surgery on a Friday afternoon before Christmas.
no.
And,
Unless the doctor is going on vacation or they're trying to get this done prior to the termination of your current insurance.
No, none of those apply. None of those apply. What
Okay.
it was during COVID, and I was damned lucky to get in. So I wasn't gonna say, no, I think we need to wait 3 months. No. But anyway, and then anyway.
No, that is an interesting experience. Strange from a couple of different ways of looking at it too. Yeah, but
Does anybody know about an ombudsman, UC Davis patient representative office? I know long decades ago, Kaiser had one. I think they've even given
I'm
it.
sure Davis has an ombudsman. You
Okay.
just have to
Okay,
find out who it is and contact them.
sure. Because then I can get my doc's attention. Because a third party contacts him, then he says, well, okay, maybe. And maybe he didn't know. Somebody knows, however. Those were human beings standing in front of me, and that was paper and a pen, etc. So
I think I understand your confusion or, well, feeling like did this happen or was I dreaming?
yeah, this was December 2021, and I've been asking since then. And I'm just not asking the right person. So, okay, thank
No,
you.
that's good input.
Rob,
Yes,
I was Paul.
Yeah.
Yesterday I went to UC, I think UCB has they share an old building with Mercy over there on C Street, way East Sacramento, by between Alhambra and I don't know, 30. Yeah.
Right.
Anyway, it was for a case study on spine, and I did some testing. And,
I can't hear you.
it'd be like,
Paul, you're
You're not-
cutting out.
Your connection is not working. I can't
Oh.
understand you.
Yeah, I'm in transit, so I apologize for that. Did
Okay,
you catch any of
no,
that?
you're underwater. No. you're
Oh.
underwater. Yeah.
All right. Well, if it goes through, what I was trying to say is, she said it could be more than a year for them to get back to me if I was a candidate.
Okay,
So,
Okay.
You know, I'm not saying that's your situation, but perhaps, but.
I appreciate that. I
Yeah.
appreciate that.
Okay, I'll mute again. Sorry.
No. Thanks. Thanks.
Well, we're always looking for ways to improve the patient care experience and to individualize care because everyone is different. The
Yeah.
person in room 1 is not the person in room 2. And who they are, where they came from, the backstory, it's all different. How they respond is also going to be different. And I would think, though, most people would have their fears calmed a little by either an orientation of some sort
Mhm.
or
Yeah, I agree.
a communication with an individual to tell them face to face, maybe, here's what's going to happen. When you come in, these are the steps, okay? And then give you information about your surgery, and information about your recovery,
Mhm.
information about if you're going to be admitted to the hospital versus being sent home,
Mhm.
what that experience is going to be like. And that sense of preparedness usually gives you a little more confidence and calms you a little bit. So again, I think nurses have a big part to play. It's challenging, though. It's challenging. And so it's a good subject. It's a good topic to bring up periodically about the mind-body connection and why we need to, well, be aware of it. Be aware of it and make the best out of that as we can, knowing that it impacts, the mind can impact the body, whether in a form of wellness or in a form of illness, you know. So any other comments? All right. Okay, so I guess I will terminate this. And thank you all for coming. Let me see if I can, what happened here?
Rob.
Bye. Oh, yeah, thank you.